Hey guys, welcome back to the OT Latina YouTube channel. For those of you who are new here, my name is Brianda. I am a pediatric occupational therapist and I provide resources for OT students and practitioners. So for today's video, I wanted to do something a little bit different and I wanted to try to walk through some NBCOT practice test questions with you. And I wanted to use one of my favorite and go-to study tools, TrueLearn. Now, full disclosure, I graduated from OT school 4 years ago, so it has been a while since I have done NBCOT practice test questions. Obviously, I haven't had to study for anything within those 4 years, but that is exactly why I wanted to make this video today. I wanted to show you how I think through these practice test questions, and I think it would be great practice to do it with me, someone who's kind of doing this all over again, because knowing how to answer test questions is just as important as studying the actual content for the exam. Now, when I was studying for my exam, I used TrueLearn, and I truly believe that it helped me pass on my first try. I feel like the questions from TrueLearn actually feel very similar to the actual exam questions. And honestly, the best thing about TrueLearn is that it provides really clear and detailed rationales, and it also references where you can find the material so that you can continue to study more in depth. Okay, enough talking. Let's dive into some questions together. Now, this is going to be super casual. I have my laptop here to read the questions, and I'm just going to take you through how I think through these questions. So let's get started. First question. An occupational therapy practitioner is fabricating a splint for a client with a median nerve injury. What position should be avoided to protect the client's wrist and hand? Okay, so two things stick out to me right away. First, you're fabricating a splint. So if you think about splinting, especially for wrist and hand, you usually want to go in like that resting hand splint position, which is kind of like, you know, not, you still want slight extension of the wrist. You don't want hyperextension, and then you want like flexed fingers, right? Y'all, I haven't done this in a while and I work in pediatrics, so I haven't really worked with like hand or wrist injuries in a hot minute. So we're going to work through this together. Okay, next, median nerve injury is the other thing that sticks out to me. So if you know what causes median nerve injuries, a common example is carpal tunnel syndrome. What causes carpal tunnel syndrome? Excessive extension of the wrist. Okay, so now I have kind of an idea of what I'm looking for. So let's look at our options. So first we have option A, which is thumb hyperextension. The word in this option that makes me think that it might be the answer is the word hyperextension, because that's literally what I just said. So we are going to keep that as an option. Next, we have option B, which is thumb opposition. So if you recall what thumb opposition is, it is a flexion movement where you come across the palm. At least that's what I remember. So bear with me. So that to me automatically screams no, because that is a flexion position, which carpal tunnel, median nerve injuries are not caused by flexion. Lastly, we have option C, which is wrist extension. Now, I did say that splinting does require slight wrist extension. And so now I am in between option A and C. But I am going to pick option A because that one, it says it plain as day. It is hyperextension of that thumb. And if you think about it, if you're in a splint, right, you don't want your thumb pulled all the way back into extension. That is uncomfortable and that can create more problems to the median nerve. Median nerve is right here, by the way. It runs all the way up into the arm through the brachial plexus. And it also shares a little bit, I think, with the ring finger. So don't quote me on that, but I'm pretty sure that is correct. You can fact check me. Anyways, I'm going to pick option A just because it has that thumb hyper extension. Okay, let me answer and I'll tell you if I got it right. Perfect, we got it. The answer was letter A, thumb hyper extension. Okay, now quickly I'm going to take you through the rationale that TrueLearn provided. Okay, let's go over this TrueLearn rationale. And like I said, TrueLearn has the best and most detailed rationales. I really like this feature. And I'm not going to go through everything with you because it is a lot of information, but I'm going to scroll down here to the answers. And I like that it explains why it is not answer B and why it is not answer C. So here we have that it's not answer B because weakness of the thenar muscles occurs with median nerve injury, along with thumb palmar abduction, and the thumb should be placed in slight opposition to facilitate functional hand use. So the main thing that I got from this rationale is that the thumb opposition is not an extension position, it is an abduction, which that just means that abduction of the fingers means flexion, right? So not the answer because median nerve injuries are caused by excessive extension. So next we have the rationale as to why it is not answer C. So median nerve injuries may be the result of lacerations or compression syndromes of the wrist. In order to reduce compression and promote functional use of the hand, the wrist must be positioned in slight extension. So if you're wanting to position the wrist or hand in a splint, typically the go-to is the resting hand splint position. So you do want that wrist in slight extension, which is why wrist extension is not the correct answer. Another thing that I wanted to highlight about TrueLearn is that if you continue to scroll down, you will see that it provides where you can find this information so that way you can continue to study more in depth. Okay, so that was question one. Let's move on to question two. An OT practitioner is working with a 3-year-old child diagnosed with autism spectrum disorder in an outpatient therapy clinic. The child shows minimal interest in toys and peers in the therapy gym, avoids eye contact with the practitioner, and has limited language skills and vocalizations. Which of the following interventions would be most effective in enhancing the child's engagement and social interaction skills? Okay, so immediately after reading this question, what sticks out to me is that they want the child to engage and focus on those social interaction skills. So I am going to look through my options and start eliminating. First, we have option A, require the child to maintain eye contact during structured tabletop activities before engaging in play. Now, option A to me seems like it is not the correct answer. And keep in mind, I am a pediatric occupational therapist, so I'm sure when I was a student, this question might have been a little bit more difficult for me to answer. But the reason I don't think it's option A is first, what sticks out to me is that word require. So we cannot make that child do anything they don't want to. And I feel like that's a very strong word, require the child to maintain eye contact. And that in itself, that activity right there is not therapeutic. There's nothing meaningful about that. So I would immediately eliminate option A. Our next option is option B, interact playfully, incorporating the child's interests to build engagement and social interaction. Okay, so option B sounds pretty right to me. I think that's probably going to be the answer I select, but we'll go ahead and look at option C. So option C, focus on repetitive task completion to improve compliance before introducing social activities. Okay, so answer C does not seem correct to me because of the repetitive task completion. Repetitive task completion is not therapeutic. And I wouldn't really see the point in doing that before introducing to social interactions. I feel like there are better ways to do that. And if you know kind of like the hallmarks of autism disorder, you would know that a lot of kids do engage in a lot of like repetitive behaviors. So instead of focusing on repetitive task completion, you would probably want to focus on more on things that are a little bit more meaningful to that child, engaging them in play, pretend play. But yeah, and also what gets me in that option is the word compliance. I just feel like that's not really a friendly term to use when you're trying to help a child integrate into like more social interactions. So out of these three options, I am going to go with option B. So let's see if I'm right. Perfect, we got it right. The answer was option B. Okay, now let's go through the TrueLearn rationale. So again, we are going to scroll past the really in-depth explanation, but we're going to go down to the options to see why option A and why option C were not the answers. So first we have answer A, which was incorrect. Requiring the child to maintain eye contact during structured tabletop activities may increase anxiety and resistance. Children with autism find eye contact uncomfortable. Engagement should be encouraged naturally than being forced. So exactly what I said, that word required just got me. It sounded forceful, just kind of how like the rationale just said. So I think that's a really great explanation. Next, we're going to see why the answer was not answer C. So prioritizing rote tasks without considering the child's interests may reduce intrinsic motivation and limit meaningful social interactions. Instead, therapy should be engaging and relationship driven. I am really bad with my words personally. And so I feel like these rationales kind of show what I'm thinking in my brain, but they just don't come out in words. But exactly, rote activities, so repetitive activities aren't therapeutic, aren't going to help this child in any way. So you really just want to focus on more meaningful and engaging tasks. Okay, let's go on to our last question. Okay, so which of the following pressure relief techniques is most beneficial for a client with a C7 spinal cord injury to avoid pressure sores while in a wheelchair? So, right off the bat, this question is asking for a pressure relief technique. The client has a C7 spinal cord injury, and from what I remember about C7 spinal cord injuries, you still have functional use of your triceps, which is this muscle right here behind the arm. And the triceps are responsible for tricep extension or elbow extension, so extending the arm out. And y'all, I have not seen an adult client in like 3 years, so this is all a little bit foggy to me, but I do remember that C7 spinal cord injuries, you still have what they call scapular depression of the scapula. So it's when you have your scapula and it can go down versus elevation where you can make your shoulders shrug and go up. And then lastly, this question is asking for pressure relief techniques while in a wheelchair. So if you're thinking of pressure relief techniques while in a bed, just get rid of that. That's not what the question is asking for. Okay, so let's run through these options. So the first option we have is A, the client will need a special wheelchair cushion due to paralysis. This one is right. The answer is right, plain as day. That's the thing with these test questions is that they kind of try to trick you because multiple answers can be right, but you have to find like the most right answer or the best answer. So I'm not going to eliminate option A. I'm just going to keep it on the back burner, but let's look at our other options. Next, we have B, instruct the client to use elbow extension and scapular depression. That one's kind of ringing a bell to me as like the winner because that is exactly what I just explained right now. So with C7 spinal cord injuries, you can still extend your elbow because you still have function of the triceps, and then you have function of the muscles responsible for scapular depression. So that answer is technically right too. And I think that might be better than option A because this is something functional that the patient can do. And you always want to make sure that the patient is able to utilize the muscles that they still have function of. So you want to make sure someone with a spinal cord injury is still as active as possible. So we're going to leave this as an option as well. Next, we have option C. Instruct the client to lean forward and shift weight forward bilaterally and over the feet. Right away with option C, I do see some safety concerns because this patient probably doesn't have any trunk control, right? Any core strength. And then obviously they don't have any function of their legs. So with option C, it just seems totally unsafe. You want the patient to lean forward, and that just screams not safe to me. They can fall over, and because they don't have core strength, they can't really correct themselves. So I would probably rule out option C. Lastly, we have option D, advise the client to return to bed after 1 hour in the wheelchair. So this answer also screams no to me because why would you want them to return to bed after only 1 hour in the wheelchair? So for spinal cord injury patients, or really any patient in general, you always want them out of the bed as much as possible. And so if they're only in the wheelchair for 1 hour, that just doesn't sound right. Like you want them to be in the wheelchair, right? You want them sitting up instead of laying down because that can cause a whole nother problem with pressure ulcers and sores. You don't want them laying down for too long. You want that blood flow of them sitting in that upright position. And so I would eliminate option D. Okay, let's review these rationales together. So, why was it not answer A? Client still benefits from special cushion to assist in pressure relief. However, active movement should be encouraged with the use of intact muscles. So, this pretty much explains that it's not answer A because, like I said, you want them to be active and you want them to still use those muscles that they have available to them. And also, this was kind of just a given. Yes, the answer is technically right because they are going to need a special cushion, but that was just not the best answer. Next, it was not answer C because, like I stated, the client has paralysis of the trunk muscles and of the lower extremities. They may not be able to lean forward and shift weight forward over the feet safely. So, yeah, safety concerns all the way there, which is why it's not the answer. Lastly, the reason it was not answer D was because Weight shift should be performed every 30 to 60 minutes. However, the clients should also increase tolerance to an upright posture in sitting. So immediately, I did mention you don't really want them in the bed. You want them sitting down because you want that increased blood flow. And also here it states elbow extension with scapular depression will allow the client to weight shift while staying in the wheelchair for more than 1 hour. Perfect. Yes. If they still have function of that elbow extension and of the scapular depression, they can still move slightly left to right versus moving forward, which is the unsafe movement. So yeah, that's why answer B was the correct answer. Okay, guys, that was the last question I will be answering for this video. But like I mentioned in the beginning, this will be a series that I am doing in collaboration with TrueLearn. If you want to try out TrueLearn, I do have a discount code. Feel free to use my code OTLatina for a special discount. I will have it linked in the description below. And like I mentioned, TrueLearn was one of those resources that I used when I was preparing for the NBCOT exam. You can create your own tests, you can answer questions by category, and then, like I mentioned, it has really great rationales where you can be directed to where you can find the information. So, yeah, TrueLearn really helped me on my journey to passing the NBCOT exam, and I really hope that it can help you too. But keep looking out for the next video. I will be answering more NBCOT practice test questions. So, yeah, thanks for watching, guys. Bye.